So we want to talk about the importance of colorectal cancer screening.
That's an excellent question. When we talk about colorectal cancer, it's one of the most common cancers, but it's also one of the most preventable and treatable when detected early. Colonoscopy is usually the gold standard when it comes to colon cancer screening, because it not only helps us detect the disease early, where we can even cure the patient, but it also helps us remove those precancerous polyps that helps us prevent cancer from even happening.
Okay.
When we talk about Iowa specifically, it does rank the 8th on the nation when it comes to colorectal cancer incidence, with an age-adjusted incidence of about 126, which is above the national average when we talk about colon cancer.
Okay.
Yep.
I know a lot of people are nervous about screening a colonoscopy. What advice can you give them?
I usually try to reassure my patients when we're talking about colonoscopies, it's completely normal to feel a bit anxious. But I usually tell the patients the procedure is not as bad as it sounds. Now, the hardest part that a lot of patients do usually experience is the prepping.
Right, which is so important, I know.
That's the idea. We want to be able to see the colon, to be able to remove those polyps and provide a good screening tool there. Now, I do want to point out that we do have some alternatives to that gallon that we usually give. So we do have these other like low volume preps that we can give to patients.
That's kind of more more people are going toward. You said the big jug, yeah.
Usually we still prefer the big jug, but they have do comparable results. And if you had a colonoscopy already and you had good results with the gallon, I usually tell them to stick with what we know works, and if they want to try an alternative, I'm okay with that. But usually I tell them it worked the first time, it likely will work the second time as well.
But that prep is everything, so you can get a clear vision of the colon.
Exactly.
Yes. Now, 45, isn't that the standard age?
Correct.
Okay.
Yes.
It wasn't at 50 at one point in time. Did they lower it? Okay.
And the reason behind that is because we've started noticing that the incidence of colon cancer is happening even at a younger age. So that shift that the U.S. Multi-Task Force for Preventive Disease pushed it from 50 to 45 is to catch a bigger portion of people who might develop colon cancer. So we are seeing it now in people in their 20s, even their 30s, and I want the younger folks to understand not to look at colon cancer as an old person's disease. Unfortunately, it can affect other people. Now, the reason we focus a lot on colonoscopies is because most colon cancers do develop silently, and we wouldn't be aware of them until the symptoms have already started to occur. There are some red flags that I like to tell patients to keep an eye for. So for people who started noticing changes in their bowel habits, unintentional weight loss, you're noticing blood in your stool, even abdominal pain, those can be all early symptoms. And therefore, if you have any of those, please do not hesitate to talk with your physician. And that would take a more proactive approach for prevention for those patients.
A lot of people I know, they're like, oh, that's something embarrassing to talk to my physician about, but it really is important.
That's the right place. That's the right place to even talk about it. Like, you're not going to
talk about
it during your morning coffee with friends. No. So the focus of all your physicians is to keep you healthy. And we deal with all types of functions, from swallowing, your bowel habits, even when you go to the bathroom for whatever reason. So all of these things are, you shouldn't feel embarrassed to talk to your physician about that. So
what are some lifestyle changes that people can make in order to kind of be preventative with their colon health?
Excellent question. So in general, we ask people to keep a healthy lifestyle. So it all starts with a healthy lifestyle. So eating a diet high in fiber, so eat your fruits, eat your vegetables, the whole grains. Keep an exercise schedule and maintain a healthy weight. We also ask people to not smoke, drink alcohol moderately or limit their alcohol consumption. And we also ask them to avoid some of the processed foods, especially when it comes to the diet, as well as a diet high in red meats. All of those can help reduce your risk when it comes to colon cancer, and obviously get your colonoscopies
Yes,
done.
absolutely. Yes,
Yes.
schedule it. Don't be shy. Where can people get information?
So there's a lot of information that's available on the internet. One of the resources I like is the one from our clinic. So you can find some more information at www.mercycare.org/GI.
Okay. All right. Thank you very much. We
You're
appreciate
very
it.
welcome. Thank you very
Yeah,
much for
thank
having
you.
me. I appreciate it.